Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations today for December 2nd, 2022. If you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. We didn't have any questions this week, but it was Thanksgiving. And so people were presumably more focused on turkey and Christmas decorations than on COVID. So as we always do, we start at the world level and then move down. And at the world level, COVID is pretty flat. We are still seeing some disease in the Pacific Rim and in Europe. But the big question of this week is what is happening in China? So you may know that China was one of the first places that had COVID. They then adopted what was called the zero COVID policy. The zero COVID policy means they do extensive testing, extensive quarantining, and lockdowns when cases are noted. And they've been, we think, and again, all of the data from China is suspect, but we think they actually have been pretty successful in keeping it out. Unfortunately, over the time, what has happened is that we're now getting more and more contagious variants, and the zero COVID policy is harder and harder to do. And for people who have had multiple lockdowns over 2 years, there's really a lot of COVID fatigue. And so we're starting to see some political activity in China. So we'll see what happens. So when China adopted the zero COVID policy, those of us who thought about it said, well, that'll be great, but how do you stop? So how do you go and relax restrictions in China? Because when they do, they're going to have millions of cases. I mean, there are 1 billion people in the country, so not surprising that they would have as many as 1 million cases in a day. And the question is, how do you handle that as a society? So that's going to be something we're watching. The other concern would be is that if China goes away from its zero COVID policy and the disease widely spread, it could be a place where new variants could really develop. In the U.S., cases are really quite flat. When we look at the map in the U.S., there's really no big hotspots. So typically when we're going to start to see a big surge, it's going to happen in New York, Chicago, L.A., and Seattle, basically areas where there are a lot of people and a lot of people coming in, but they have been really quiet. And so the number of cases in the U.S. is pretty flat and pretty stable. Now, one of the things that we have seen is that there are new variants all the time. So they're still all Omicron, but you'll remember we started with BA1 and BA2, and then went to BA4, BA5. Now we're at BQ1 and BQ1.1. So the Omicron has been very good at continuing to evolve. The BQ1 and the BQ1.1 don't seem to be any more severe or any more contagious, but the spike protein is different enough that people have the earlier versions of Omicron. So people had disease back in the winter or in the spring, have very little protection against this new variant. And the monoclonal antibody, which is called bebtelovimab, don't have to remember that, but bebtelovimab, which is this injectable antibody that we've given to people after they're diagnosed, which really decreases their risk of hospitalization and death, doesn't work against the BQ1 and the BQ1.1. So from early on, we've had different monoclonal antibodies available. Now we have none. And so that takes one really important tool out of our toolbox. Now, the good news is the BQ1 and the BQ1.1, you do get good antibodies from vaccine. So we'd certainly recommend the vaccination. And the Paxlovid still works. So we really would recommend if you're positive and a high risk that you talk to your doctor about getting the Paxlovid. Again, the bebtelovimab is no longer seeming to work. In Oregon, kind of flat number of cases, although we have seen a steep increase in the number of hospitalizations in the last week. And in Douglas County, we're also kind of flat. We are seeing an increased number of hospitalizations. A few weeks ago, you remember I said when you had 4 people in the hospital, none were on oxygen. Not that way now. Now we have 12 Douglas County residents who are in the hospital, and those 12 Douglas County residents sort of scattered around the state, some really quite sick. So we're worried that we're starting to see an increase in severity similar to what we're seeing in the rest of the state. The biggest issue, though, is that at the same time COVID is coming up a little bit, we're seeing really historic spikes in both flu and RSV. So flu and RSV diseases are diseases which circulate every year. You typically don't have very good immunity to it, so you can get it year after year. Flu can be prevented with the vaccine. RSV, there is no vaccine. And so we've had really quiet RSV and flu season in the last 2 years, thought to be because the stuff we did to prevent COVID, masking, distancing, staying home when you're sick, are pretty effective for COVID, but they're really effective for flu and RSV. Well, this year, since we're not doing quarantining, this year when people are going to work sick, we're starting to see these diseases spread. So, for example, this morning, Mercy had 11 people hospitalized with influenza, 8 with RSV, and 6 with COVID. None of these individual diseases would really be crippling, but put the 3 together, and the Oregon hospital system is really, really struggling a bit. There are a bunch of hospitals that are on divert. There are many other hospitals where, even though you're not on divert, you're sort of waiting for a bed, and people can wait in the emergency room days and even sometimes several days before they can get a bed. So we're at a kind of a tough time now, not all because of COVID. If it was just COVID, this would be much less of an issue. But COVID on top of flu, on top of RSV, really are causing a bit of a problem. Again, there are lots of vaccines out there for COVID and flu, and the COVID vaccine seems to be very effective. We look at hospitalizations every day to see if people, which of the COVID vaccines they've gotten. So what we note is that people who've gotten the bivalent vaccine, none have gotten hospitalized. Now, there are people who got the initial vaccines in early 21, like 18 months since their vaccination, and they are getting hospitalized. So what we know is that immunity against respiratory diseases does not last long. So it really is critical for people to go ahead and get their bivalent COVID booster and their flu booster. There are still medicines out there to treat COVID. The medicine that we would use to treat flu, which is something called Tamiflu, is in very short supply. And there are many pharmacies in Oregon that are out and awaiting new shipments. So we're a little worried that as flu gets worse, we won't have the Tamiflu that we need to treat them. But overall, slight increase in COVID, marked increase in flu and RSV. We're kind of holding our own for now, but we really want people to stay safe. So a couple of things. Get your shots for COVID and flu. They're out there, they're available, they're low cost. If you're sick, stay home. It is hard to know which of these 3 diseases you have when you're sick. So stay home, get tested for flu, get tested for COVID. If you're positive for flu or COVID and are high risk, talk to your provider about getting an antiviral medication. For babies who get sick or older people get sick, they should also get tested for RSV. And with the amount of disease we're seeing now and the stress that we're seeing in the hospital, it makes sense to take extra precautions. So you'll remember back when COVID was really strong and there was lots of stuff we recommended that people delay high-risk activities and to wear a mask. We've not done that over the last 6 or 8 months, but I think at this point, it does make sense to go back to being careful about high-risk activities. And with the holiday season coming up, there are going to be some of those high-risk activities. And to consider wearing a mask if you're going to be in a high-risk situation. So we traveled a few weeks ago, and my wife and I wore a mask the entire time we were in the airport of the plane, knowing that we were going to be around a lot of people. And we did not want to be either catching the disease or, if we had it, spreading it to others. So again, we're doing okay, but we're a little stressed now with the triple-demic of COVID, flu, and RSV. Stay safe, get vaccinated. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County for December 2nd, 2022.